morning, everyone, and welcome to day 2 of Innovation Week. I hope you found today as interesting and as engaging as yesterday. We have another content-packed day today with our first session this morning on the COVID responses. Later on at 12 o'clock, we'll have a keynote from Laoghaire Sudman. And then at 2 o'clock, we're going to have an interesting session on how strategic foresight can help public servants anticipate and better prepare for the future. So we hope you can log into as many of them sessions as possible. Just before I kick off this morning, I would like to remind everyone we do have a Q&A function. So if you look on the right-hand side of your screen, you should see a panel and you'll be able to add questions and comments onto this section, and we will try to pose as many of these to our panelists both in this session and throughout the day. So for this morning's session, it's titled COVID-19, the Response, and I'm delighted to introduce our 3 distinguished speakers this morning. First, we have Noeleen McHugh, who's Assistant Chief Executive in the Local Government Management Agency. Noeleen has spent many years working in Fingal County Council prior to her move to the LGMA, and she's now responsible for providing support to local government sector in the area of project and programme management, reform and innovation. We've Marco Daglio, who's the Deputy Head of Public Sector Reform Division at OECD. Marco is also the Head of the Observatory of Public Sector Innovation, or OPSI. It's a flagship initiative of the OECD to support and advise governments in making the most of innovative approaches to transform public sector. And finally, then we've Professor Martin Curley, who's the Director of Digital Transformation and Open Innovation at the Health Service Executive. And Martin's role in the HSE is to help enable digital transformation of Ireland's health service, which is no mean feat. And I suppose before I start, I'd like to thank Martin and his team for their support over the last few weeks, and especially this week. Lorraine Smith and Ross Cullen have been giving us untold support. I know Lorraine was on the emails late last night, and we rang Ross in an ungodly hour this morning. So thanks to Martin and his team for that support over this few weeks. It's an international look at the response to COVID-19.
Thank you, Vinny. Thanks. And I'm very glad to be with you this morning. Thanks for the invitation to join the innovation event that you're running this week. Perhaps something quick about the Observatory of Public Sector Innovation. So we are a center, a unit within the Public Governance Directorate that has a mandate to look at innovation around the world, what they are, how they take place, and support and advise governments in making sort of innovation happen and in their own constituencies and in own jurisdictions. So when the crisis started, and that's a sort of a first important point for us, was to ask ourselves how can be of help in this sort of extraordinary times. And what we noticed is that there was enough evidence of how countries were starting sort of pulling together their answers and their initiatives to fight against the COVID-19. So we created a database to source and track the innovation related to the response to the COVID response, and we had in 2 months more than 300 cases that basically we used to source our insights and analysis on what was happening and provide advice. So we produced a policy brief that really looking at it's a sort of a condensed overview of what these innovations are, how they work, in which areas they are, and that led to a piece that is going to be published soon later in the months that look at how also the implication of the COVID-19 crisis and the transformation of the public sector. So 2 different pieces. But what we also noticed is that there was a lot of learning, and there's still a lot of learning going on in different constituencies, in different contexts. And it's not enough for the OECD to be there to provide support, but we see ourselves as a role to try to start providing meaning, providing sense of what is happening around, but being also very understandable of the different contexts in which the responses was taking place. And that led to think a little bit different. And we thought it an event that will bring the sort of the voices of the bottom up, the local constituencies and local jurisdictions that are fighting against the COVID on a daily basis, with the insight from the leaders that are taking decisions that are nationwide, would really be a good way to bring different types of conversation together. And so the government after shock is an event that will happen at the end of November, sort of 17, 18, that will bring a lot of this conversation together to start sort of thinking about the implications of what the COVID is, but also what would be the next steps and what is going to be the new normal after the crisis. Next slide, please. So moving from there, we started sort of considering what would be how can we read into what the governments have done so far? What are the single individual sort of type of responses that we've seen? And I want to start with this slide by perhaps a quick citation that we think it holds truth to the times we're living here. There are decades where nothing happens, and there are weeks when decades happen. And this is a citation from Vladimir Lenin that is particular from coming from the OECD, but I mean it really captures in a nutshell what is really happening. We're seeing a lot of advancements, a lot of acceleration in many different fields happening in a very short amount of time. I think that this idea of compressed time for transformational reform is something that it really holds true of the moment of the world we are living in today. So what we're seeing is that there's been an incredible acceleration of digital innovation and transformation, not only moving services from virtual to digital, but also in the way the government is communicating about the crisis. The online means have completely taken over from other types of communication, and this all has been enabled by dedicated team, dedicated resources, units, and partnership as well, because we've seen a lot of innovations that are being pulled out from the bottom up with the intervention and the strengths and the commitment of groups and individuals dedicated around the world. One of an example of this is the United States Digital Response, which is a voluntary-driven initiative that has been initially led by pro bono technologists that really was focused on helping local governments cope with the digital transformation. And this initiative that was really bottom up started with a few people involved and scaled up to about 5,000 volunteers that were working together to support local government implementation. Very interesting to see how this has happened, and there's similar initiatives happening across the world. Another things that we're seeing is that there is an increasing attention to leverage bottom-up solutions and insight from the crowd. And this really goes into an important point. So government quickly realized that they don't have all the information, they don't have all the answers. And it's very important for them to start sort of leveraging on the expertise of citizens and business to provide new links, new ideas, new solutions to a very common problem. And an example of that is that we think is noticeable is that not only hackathons related to the crisis happen nationally, but there's initiatives that had a larger sort of global hackathons happening across that was initiated the government of Estonia, but rapidly to involve more than 2,000 people and participants that contributed to providing sort of common solutions. A third element that is peculiar and interesting that it's up for us also to think in terms of the different facets of the response is the resurgence, if you want, of social solidarities and caring. And this is not just individual initiatives that we have seen mushrooming a lot of a local level of groups helping each other, but most importantly is the support of governments into sort of scaling those and making them sort of more feasible and sustainable over time. Think about in the UK, there are about 8,000 aid groups working with local governments already. one of the such schemes, the NHS volunteer schemes that have in times of weeks have involved 1.5 million people signing up to volunteer to do very basic things, shopping for people, medication, sort of child and support of people in need. So that is an important sort of trend that we see coming. A fourth element is the tracking initiative that has been focused on tracking how the virus is diffused and in order to reduce contamination. And this is an important element because at the basis of that is really the need to ground decision-making into better evidence and better data, better information. So we're seeing a number of tracking apps that many knows already, but also other things that have been done with not very big resources. For example, so Singapore has is produced sort of thermal scanning, used thermal scanning software in airports and in shops, sort of to being able to have real-time data on who has the fever and who doesn't have it. And this has been done in a matter of just a couple of weeks. There is a final sort of category of things that we are seeing that is also important is the initiative that have been focused on sort of rethinking a post-COVID social and work environment. So this is about really trying to start reimagining what will be the status quo after the crisis. And there's a lot of things that have been emerging from cities that have really occupied really the thinking space in terms of how we can really think about systemic solution, but that can be implemented and acted on locally. For example, in the city of Paris, there's been initiative that focus on the redesigning and repurposing public space for increasing mobility. In the Netherlands, there's network or local government that have start thinking about how the principle of green recovery could help inform the reconstructions or sort of the redesign of services into the future. Next slide, please. So I think that against all what we've seen as important sort of approaches and initiatives to fight against the COVID, we also, I think, we also see that these are unveiling a number of vulnerabilities in government, and the crisis has really showed that government, as in many respects, found a bit unprepared in facing this. And I think that one of the biggest vulnerability that we've seen is that the crisis has strongly exacerbated inequalities. So the poorest have suffered the most from it, and I think that tells something very important, that it's not we have to deal with social inequalities in the good times, because when the crisis hits, it's always late, and there's other urgencies and preoccupations. The second is really about the disconnect. We see a disconnect between the scale and complexity of the issues that came through the crisis, and the type of tools and policy responses that were thrown to them. I mean, I think this is the old-fashioned way of saying that we are facing 20th century's challenges with 19th century tools. So we really have to scale this. We need to transform using different tools and different methods to approach these problems. And also, we know now that the linearity of policies doesn't work for facing the complexity that we are in today. And we know that we cannot talk about policies around rural communities without discussing sort of the question of the elderly and policies towards them. We know that there are strong connections between environmental issues and economic issues. We know that education and health are very much linked. So there is the multi-causality that hasn't been really taken into account, and that the crisis has exacerbated the issue that needs further attention. Now, the third, perhaps, vulnerability has been that of the sort of a link that hasn't really worked between the capacity of government to see into the future and to envisaging a future and their ability to act on that. A number of public sector organizations have in their risk registers, there was clearly an item that really looked into the global flu virus outbreak as a possible event. But why so many of these governments have sort of found themselves sort of off guard when the outbreak, when the crisis happened? And I think that this has a lot to do about this disconnect. So here governments, we think that they need to work better on acting on foresight and think that anticipation needs to build and to inform actions more forcefully. And finally, perhaps a close link that we all seen sort of under our eyes, the question of the relations between trust in government and effectiveness of policies has been one that has evolved over the crisis, but we can certainly say that sort of poorly trusted government have more difficulties on introducing sort of hard policies. So how this relationship will evolve will only be telling us more about the importance of building trust in institutions, and how to do this will be an issue that government will have to face in the next time. And finally, sort of next slide, please. One of the questions that we are very much preoccupied about, and that I think it can, it's something that many governments are really asking themselves. I mean, in the context of this crisis, what are the things that we can keep, and what are the things that needs to leave behind? In our own reflections, we've seen perhaps that are a number of things that we can certainly keep, and one of that is the sort of emergence that we've seen of a new social contracts, if you want, where there has been an acceleration of the willingness of different partners in society to come together and to respond to the crisis. If you think about business going above and beyond in producing ventilators when they were needed, governments have accelerated the debureaucratization of a lot of processes to make sure that this happens. On the other end, and people sort of jumped in to support all these efforts with a strong volunteer component. So this all tells about is sort of what we called in the OPSI a mission-oriented approach, mission-oriented innovation. And I think that this is something to keep in mind as, you know, once the crisis will be behind us. This is something, the same attitude, the same momentum and energy can be channeled to other important crises. Think about climate change, for example, or tackling social inequalities. And again, something that to keep is this fast acceleration and the agility that government really showed during the crisis. The speed of transformation has been very, very, very strong. And we can't reverse this process. There is an expectation also from citizens that this is the way that government will, if not, will continue to operate that way, but there is an expectation that this is the pace of transformation now. How can we respond to that? And something that certainly that, as I mentioned, that we wish to government to consider for them to sort of to leave behind is sort of this one silo way of approaching policy design and policy making versus the collaboration efforts that we have seen or mushrooming along those over the last few months. Last slides, please. And as a final consideration, I think that the crisis also prompted us to think about how to build innovation more forcefully as a core function of government. How can we build innovation so as it's a function that can help us prepare for the future in a context where there's a number of uncertainties and complexity that we need to deal with. So this is not at all a checklist. In reality, is a sort of thinking moments that we invite everyone to sort of to consider. And the first one is really about thinking more carefully about what types of innovation is needed in what circumstances. And the crisis really shows that what we have seen and experienced is a lot of sort of learning by doing and being able to flexibly pull out resources in a context of a very changing environment. And we are talking about the sort of adaptive innovation type of things where your environment is swiftly changing and you need to jump and to adapt. What government have been used mostly is sort of a enhanced oriented innovation. It's really about working on a pretty stable knowledge base, optimizing it and making sort of exemplary sort of adjustment and little steps forward. But this doesn't really take the level of transformation that you need in these times. Is of course needed, and possibly there is there's sort of a movement around these four areas that you need to embrace. But when it comes to anticipating the future, embracing uncertainty, there is a space that needs to be created inside government to fast approaching small-scale experiment and testing radical solution in a different domain: public transit, social care, livability. I mean, there's really a need to sort of bring it back, this idea of exploratory innovation that helps anticipate and test at small scale and prepare for the future. Thanks a lot for your attention.
Thanks so much, Marco. I really like that idea of OPSI being an entity that listens, analyzes, and then generates the shared understandings. I really get to see the benefit of that from my own position in the Public Service Innovation Team, because we get a great oversight of what different departments are doing, and we can clearly see that many departments definitely have common issues, and therefore they should have common solutions. Now, we have tried to crack some of them solutions, but we're not there yet, but we're certainly working on it. So I'd definitely like to talk to you a little bit more about that later. I'd like to now hand over to Noeleen McHugh, who's the Assistant Chief Executive of the LGMA, to present from a local authority's point of view.
Thanks, Vinny. On behalf of the sector, I suppose, and the LGMA, I'm delighted to be here this morning to share the story of the local authorities and the local government sector's reaction to COVID-19. I'm just going to briefly talk about a report that we commissioned earlier in the year to capture some of the innovations. I'm going to look at some of the positive effect, I would say, on the public realm, and just with some overarching conclusions. So we commissioned a report on an overview of local authority COVID-19 innovations, and we did this in April. It was very soon after the beginning of the, sorry, next slide, I think. And again, thanks. Yeah, so we were very keen to capture what had happened. We were wondering in April whether it was too soon to go out. We knew people were busy. They were managing beaches and parks and council offices, community centres and so on. But we, at the same time, we were keen to capture what was going on, because we wanted to make sure that if we came back later on, we might have missed so much. So we decided to go for it. The other issue we were thinking about as well was also that we would be able to collaborate, encourage collaboration, so we'd be able to publish it fairly quickly, that people would be able to learn from their colleagues around the country and maybe not have to reinvent the wheel. So we administered the questionnaire online. There was a 2-week period to respond in April, as I said. We got a response from every local authority, which was great, and some of the LGMA business owners. And overall, we got 91 responses, which outlined 214 distinct innovations across all the functional areas of the local government sector. The data was analysed relating to specific challenges, next slide, sorry, which the sector experienced as a result of COVID. And our analysis showed that 51% of the innovations that were reported came around the delivery of public services, followed very closely by 47% of the challenges relating to internal processes and staffing, which mostly would have been moving staff to a remote working environment. And the remaining 2% of the challenges that were identified related to providing services to our elected representatives, who will be the city and county councillors around the country. If We can move forward there. So then we looked at the general themes, we analysed them at a more detailed level, and we identified sub-themes for each of the three main types of challenges experienced. And the results showed that 24% were experienced in non-IT services, followed by 18% which were managing the internal IT, and then followed by 15% of challenges which were around public service delivery to community and voluntary groups, which would largely be the community call, which I'll talk about later on. And the next biggest one there was libraries, which had very specific challenges trying to keep their services going during a time where their buildings had to close. So we can move forward. So we also then wanted to look at the structures that have been used in addressing these challenges, and we found that in the context of formal or informal structures implemented to address the challenges, 86% of them were managed through either a formal or informal existing local government structure. 48% using the very formal existing structure, and then some structures being set up to deal with the 38% of others. Some of the key learnings then. Next slide, please. When we looked at the key learnings and the obstacles identified by the sector, we found that in the top key learning was the need to ensure that sufficient IT capabilities were available to support those internal services. This was followed by the need to update business processes and supporting staff working remotely, and then greater use of online and telephone communication channels for public service delivery, and the desire to upscale successful customer initiatives also scored very highly in this analysis. So I'll move on now then to talk about some of the case studies that we identified. So we identified 4 particular case studies that I'm going to refer to in the next 4 slides. We can move forward. And again, please. So the first case study was in the libraries, and in this case study, it was noted that reading stories to children in libraries, which is called story time, is allowed under current copyright law. If the activity takes place online, a digital recording of the activity was made, and this is not allowed under copyright law, which meant that libraries could face copyright infringement issues if they read the stories on Facebook live during the restrictions. So to deal with that, a structure was put in place which involved the LGMA Libraries Development Unit working with the Department of Education, the Irish Copyright Licensing Agency, the Publishers Association and the Writers Union. And the agreement was reached to waive any liability for libraries during the COVID-19 restrictions, and the Libraries Development Group agreed that Irish children's authors would be promoted throughout this endeavour. So the key learning was that there was a new partnership developed with potential for more joint activities for the future, but it was seen very much as a temporary solution, and there needs to be more consideration of copyright legislation on whether it's now fit for purpose. Next slide, please. So the second case study were waste permit inspections. So South Dublin County Council has over 40 permitted waste facilities. As part of that permit, they have to inspect the premises every year, several times, and obviously due to social distancing restrictions, those physical inspections were very difficult. So a structure was set up between the local authority waste enforcement unit and the operators, and they proceeded to carry out the remote inspections utilising drones. And then obviously through phones and video and email and so on, they were able to complete the inspections. So this ensured compliance with the permit. It was very essential, obviously, that the enforcement inspections were maintained. And the use of technology, which allowed a virtual tour of the property without a physical presence, also helped to develop trust and cooperation between both parties. Next is the automation of chief executive orders and HR forms. So Monaghan County Council were trying to deal with the issue of increments for staff and chief executive orders, both which are highly multi-step manual processes, and they usually involve moving paper around multiple office locations. In this instance, they put together a working group between HR and IT, And they came up with an electronic and automated process which was able to manage this process during restrictions. The key learning, I suppose, is that under legislation, the chief executive orders do need a manual signature. And it was agreed that if a digital or electronic signatures for the public service could be put in place, this would be a welcome development and enable much more process automation going forward. And then our last case study is the community call. So on the 27th of March, I think it was, the government announced that anyone over 70 or medically vulnerable had to stay at home. And each local authority was tasked by government to provide a local response to meet those needs. A structure was put in place with each local authority establishing a community response forum, which generally involved the community, sports groups, the voluntary sector and other groups. They managed and set up a community call helpline and forum, and they created and activated them across the country over a single weekend. They generally dealt with responding to needs including delivery of groceries, fuel, medication, meals, other essential items, and they also had supports to combat social isolation, so you could just ring up if you wanted to have a chat. Obviously, we harnessed the services of across the whole community to provide those supports, and we've responded to well over 55,000 calls to date. This was very successful in meeting the needs that were required, and the structure was very successful, providing an excellent example of what can be achieved when the local authorities, the community and voluntary sector work together. We later were asked to facilitate the restart programme for businesses, so we managed all of the applications from across the country for businesses seeking those grants to reopen their premises as well. And again, turned that around in a very short time. So the next slide, please. The impact on the public realm is interesting. When John F. Kennedy was a senator, he was in the Senate in 1959. He told everyone that when written in Chinese, the word crisis had two characters, one representing danger and the other representing opportunity. I don't think that's factually correct, but just to give a sense of the opportunity that was available, and I think Marco talked about it earlier, there were a few good things that came from COVID, but I think some local authorities have taken the initiative to see the crisis as an opportunity to introduce some measures, and they would have been very hard to do in normal times, but they came in very quickly. So the first example, Dún Laoghaire Rathdown, so they introduced temporary measures to address the challenges in the public realm, including a two-way segregated cycle lane from Blackrock to Dún Laoghaire, a one-way traffic system in Blackrock, and other cycle facilities, and a parklet then in Dún Laoghaire on the street there to enable outside dining and support local businesses. Cork City Council, next slide please, had already the Reimagining Cork plan, but they were able to accelerate that to include investment of up to 2 million in this wider city's existing cycling infrastructure and significant pedestrianisation of the city centre, which meant that up to 1,000 residents and visitors could eat and drink al fresco. The business is hard pressed for space to meet those COVID-19 restrictions. We're able to expand out onto the 1.3 kilometres of temporarily pedestrianised streets, creating a more pleasant, safer and greener city. The next example is Dublin City Council. There was a dramatic decline in the number of people travelling each day on cars and buses and trains. So more space was required for social distancing for people going on buses, and the increased facilities for people cycling and walking and travelling by car. So they developed a framework of proposals with the National Transport Authority, including additional space for pedestrian movement, safer cycling facilities, additional space at bus stops, and they had some pedestrianisation of streets there that you can see in the top left hand corner. These are temporarily implemented and are being reviewed periodically. The next example then is one of our famous parklets. It's Limerick County Council. So they basically took a car parking area on the side of the street. They turned it into a seating area for 12 people and completed it over 5 days. They put up 3-metre high bamboo planters. They have new cycle stands. And again, it not only enhances the public realm, but it also complements the Caffey Street quarter of Catherine Street in Limerick. And then finally, Clare County Council introduced a mobility plan for Ennis. It included traffic rerouting to ensure the street space could be shared safely by pedestrians, cyclists, public transport and cars. They provided parklets there with age-friendly seating. They adjusted their parking and street layouts to provide additional space to meet social distancing requirements and prioritise click and collect parking. And they managed the shortfall in parking by developing an additional parking area on the outskirts of the town centre. Next slide, please. So, to come to our conclusions, and this is my last slide. At the level of government closest to citizens, I think the local government sector has developed and implemented innovative solutions across all its functional areas in response to COVID-19. I think the local authorities have shown they have the skills and capacities to respond to a diversity of challenge and demonstrated an ability to develop novel solutions to complex problems, most of which were delivered within local authority structures. The sector has also taken advantage of opportunities to deliver new ways of enhancing the public realm to support the residents, businesses and visitors. So that's the end of my presentation. I'd just like to thank my colleagues from the local authorities who were featured on this, to say that nearly every local authority has done something, and I just had to pick a few. And I look forward to participating in the panel and answering any questions that may arise. Thank you.
Noeleen, I was just saying congratulations and thanks so much to you and everyone at the LGMA on your COVID-19 response report. We're in the process of completing a version of this for the public service ourselves, so we completely understand the work that goes into delivering a report like this. With a librarian on our team, Catherine Matters, it would be remiss of me not to mention the incredible transformative work being conducted by libraries all around Ireland. I myself have benefited from this during the lockdown, been able to view books online with BorrowBox. It's an incredible service. So I just have to give that shout out to Catherine and all the library services out there. I certainly hope to pick up on this a bit more with you later on. Before we move on, I'd like to remind everyone that there is a Q&A section to the right-hand side of your screen. If you have any questions for the panel, I'll be sure to pose to them after our next speaker. So without further ado, I'd like to introduce our final speaker, Professor Martin Curley, who's the Director of Digital Transformation and Open Innovation at the HSE. Martin.
Great, Vinny, thank you, and good morning, everybody. And it's a real privilege to present this morning. I want to thank Breda and Vinny and congratulate them on such a fantastic lineup for Innovation Week. Hopefully you can hear me. I'm going to move quickly through my slides. I'll give a very brief introduction of what HSE Digital Transformation is and our strategy, and then I'll talk about our COVID response. So HSE Digital Transformation is in existence about a year, and our role basically is to put together a robust process and drive solutions from ideas through to broad adoption of digital solutions. And we have a tremendous responsibility because we are very far behind in Ireland in terms of our adoption of digital solutions, but this also creates a great opportunity. So if we can move to the next slide, please. So we have a roadmap, which is essentially a 10-year roadmap, but our goal within 5 to 7 years is to become a European leader in digital health, and ultimately over a decade to become a global leader in digital health. If we can move to the next slide, please. So I'm going to try and give you a drive-by shooting of our digital transformation strategy. We have 5 vectors. The first one is we've established a digital academy, and the flagship of that is a digital health transformation masters that has been co-designed and is co-delivered by all of the Irish universities. And currently we have 50 people undertaking that masters. We're currently open for applications for the second year of masters, and so far we've had 400 expressions of interest, which is tremendous. We have a digital solutions portfolio, and we're managing about 50 different promising technology solutions. And during the COVID period, we've been able to accelerate a number of those from ideas to broad adoption in a matter of weeks. We have an overarching innovation strategy for digital health nationally. We call that Stay Left, Shift Left. I'll talk about that in a moment. And we also have a forum called the Digital Academy Forum, which is run every quarter, and we've had OPS 2020 represented at that a number of times. So next slide, please. And next slide, please. So our digital innovation strategy, and this has stood us in good stead during the COVID pandemic. The first part, Stay Left, we want to help people who are well stay well in their homes, or if you happen to have a chronic condition, that you can be managed best of all from home. So that's what Stay Left is. Shift Left is about moving somebody as quickly as possible from an acute to a community and to a home setting. One of our big successes during the COVID pandemic has been remote management of COVID-19 patients, and I'll talk about that in a couple of slides. So next slide, please. So the methodology that we use for actually designing and delivering new digital solutions is called Open Innovation 2.0. We talk about this as the new mode for digital innovation. And I recently published a paper in Nature around this methodology if you're interested in finding out more. Next slide, please. So Larry Downs and Paul Nunes wrote a book called Big Bang Disruption. And this is where actually the normal adoption cycle for a technology is rapidly accelerated and happens in a big bang. And this is exactly what we witnessed during the COVID pandemic, that COVID has acted as the catalyst for Big Bang disruption. So instead of taking sort of typically maybe 2 years for adoption of a new product, it can happen in a matter of weeks. And I'll give you plenty of examples of that. Next slide, please. So this is a look at our digital transformation portfolio pre-COVID. We have 4 phases: exploration, proof of concept, demonstrator, and broad adoption. And these phases align very well with the 4 stages of clinical trials. And if you move to the next slide, please, we'll see how dramatically that funnel was transformed. We had many more solutions in proof of concept, a number more in demonstrator, and we had 7 or 8 solutions that were broadly adopted. And I'm going to talk about some of those solutions now. If I go to the next slide, please. So we opened up a solutions portal, and the OECD presenter talked about bottom-up ideas, and we collected more than 100 solutions from citizens, from big and small industry players, from universities, and we reviewed those using a robust process. In the next slide. Probably one of the key things that we're most proud of is a remote management solution for COVID-19 patients. So at the start of the pandemic, all hospitals with COVID were being hospitalized. And we went from an idea to a working solution that was being prescribed in just 3 weeks. So patients with mild or moderate solutions were prescribed an app and were given a Bluetooth-enabled pulse oximeter, and they were monitored from home. If their oxygen saturation level dropped below 94%, then an automated trigger was generated and a clinician was alerted and brought in to escalate. At the high point, we had more than 1,000 patients being monitored remotely using this solution, and this saved tens of thousands of bed nights and kept the hospitals open for more sicker patients. Normally, the adoption of such a solution would take about 2 years based on the prior data from the HSE. We went from no solution to a full solution to broad adoption in about 30 hospitals and assessment hubs in the space of 5 weeks. So it certainly was an example of Big Bang disruption. Next slide, please. a very simple but yet very effective solution was the adoption of non-contact digital infrared thermometers. So in the past, the nurse or whoever's taking the temperature had to have contact with the patient, and there was a disposable part that was used to take. We were able to source a tri-temp thermometer that was made in or designed in Belfast, made in the Czech Republic, and we introduced over 10,000 of these into the Irish Health Service, and they eliminated contact between a nurse or healthcare assistant and a patient, reducing the risk of contamination, but beautifully were 5x cheaper in terms of total cost of ownership than the existing thermometers used across the healthcare system. So it's another big bang disruption that had a lot of impact or positive impact and benefit. Next slide. Very early on in the COVID pandemic, we were able to work with a company called Redzing to repurpose their Blue Eye technology to provide just one-touch video consultations, and we broadly adopted this across mental health services and in some acute hospitals like St. James's Hospital. So this was adopted within a matter of weeks of the pandemic starting, well before Zoom or Teams became mainstream tools used through the pandemic. Next slide, please. Remote consultations for GPs with patients were very uncommon prior to the pandemic. In the space of 48 hours, we worked with two companies, Lola and Newest Solutions, to stand up remote consultation, video consultation tools for our GPs. And then within 48 hours of the solutions being deployed, we had more than 600 GPs and clinics up and running on both of those services. So over the space of 4 days, we went from nothing to broad adoption of video consultation with GPs, and it became a commonplace service utilized during the pandemic. Next slide, please. This was next, the innovation I want to talk about wasn't a technical innovation, but it was a legislative innovation. Prior to COVID, it wasn't possible for a GP to send an electronic prescription to a pharmacy. We quickly convened a meeting jointly with the Department of Health and the Irish Pharmacy Union and the Irish College of General Practitioners and one of the big GP suppliers, Clanwilliam. A new legislative, after two weeks or two meetings, it was decided what we needed to do, and some secondary legislation was introduced by the Department of Health that made it legal for a clinician or a GP to send a prescription electronically to the pharmacy for dispensing. And again, we had big bang adoption. We went from zero prescriptions being transferred electronically, but within 48 hours, we had a volume of 10,000 prescriptions being transferred electronically. And this was very important. It avoided contamination issues with paper, and patients were able to have their solution dispensed without having to go to the pharmacy to pick up the prescription. Next slide, please. Accord was a solution that was introduced initially in Beaumont Hospital, and it was designed over a weekend, one of the first weekends when we were looking at the images from Lombardy in Italy. And the solution was designed and deployed within a month. And essentially, this is a tool to help experienced and non-experienced doctors make decisions on what patients needed ICU and what patients were okay to stay in a standard respiratory ward. To date, this has been deployed in 6 hospitals and is available for use nationally if we need to go to it during the current wave of the pandemic. Next slide, please. We deployed a very novel technology both into Beaumont and Cork University Hospital, and this records the automated respiration rate of a patient, and this was very significant and helpful during the COVID-19 period. because it avoided close contact between a nurse or healthcare assistant and the patient. This is providing prediction about 12 hours in advance of if a patient is deteriorating. So it's been a very effective tool, and we're looking to proliferate this nationally now. Next slide, please. While COVID went on, we still went on about our business, and we were pleased last week to announce a new network of digital labs which are helping with the testing, trialing, and broad adoption of digital solutions. As I said, we go through 4 phases: exploration, pilot, demonstrator, and broad adoption. And if we can move to the next slide, please. A key concept that we introduced is a network of living labs. And a living lab is a user-centered open innovation ecosystem environment, often operating in a territorial context, integrating concurrent research and innovation processes within a public-private people partnership context. So if we go to the next slide. So while responding to COVID, we were able to continue with our normal business, and we announced this network of 10 digital labs. Many of these labs actually had direct relevance to COVID. And if I just give you one example, in our Sligo Living Lab, part of that living lab is a virtual ward for older persons with mental health issues. And we deployed a network of Amazon Echo shows so that the clinician and the consultant could be in regular contact with a patient, and the patient also would have the opportunity to do video calls with their friends and immediate family. Next slide, please. I just want to finish with one of the solutions that we're looking at in our digital lab. We're calling for and advocating rapid antigen testing, and that is a decision for the clinicians within the HSE. But what we've been testing and trialing is a digital platform. So if we were to adopt rapid antigen testing in Ireland, we would have a device or a solution that actually could digitally manage that. So what's showing on the screen is my passport and my COVID status, which currently shows as amber. It's a medium risk because my status is unknown. And there's also a QR code that somebody can scan to find out what my status is. So we've been testing this digital solution, and if the country decides to adopt the rapid antigen test, then we'll have the infrastructure and solution ready to deploy that. I'm very conscious of the time, so I'm going to stop there, and I'm going to hand you back to Vinny. Thank you for listening.
Thank you so much, Martin. It's incredible to see how quick you were able to mobile ideas, say from the assessment gate right through to broad adoption. So from listening to all the speakers, I suppose one thing that comes to mind is that saying from Mike Ryan from the World Health Organization, which is fairly famous now, is that speed trumps perfection. From all of your stories, it's clear to see how fast we were to react. Marco mentioning that there was 434 innovations tracked from 56 countries. Noeleen mentioned all of the local authorities' responses, and Martin just giving us a detailed response from a health perspective. I suppose maybe going to Marco first, have you ever seen a coordination like this before at such a concentrated level?
Thanks, Vinny. I have to say not really. And I think it tells something specific about innovation as a practice in the context in which it is deployed. Very oftentimes what we see and what we hear is that you need a crisis to engineer innovation into the system, and without that external prompt, nothing really can happen. So, but I mean, we want to a bit of reverse the thinking of that we don't need to wait for a crisis to create the capacity to produce innovation in a deliberate and consistent way, so that when a crisis hits, we are ready to go. So I think that for the context of the Innovation Week, and one, I think, of the core messages really thinking about that, because I was impressed by Martin's presentation. Many of this technology innovation have sort of quickly been put into the ground at a pace that was unbelievable only a few months ago. So, but how can we create the infrastructure and the potential for this to be deployed in advance, and what we want to keep of this going forward, I think will be the key questions into the future.
Excellent. And Noeleen, then, like where do you think this comes from? Is this, say, from a local authority, like it's so front-facing? Do you think this is a uniquely Irish thing where community just means so much to us, or why did we just rally around so quickly to kind of deal with the threat that was in front of us?
Well, I think that's the answer, isn't it? We were all in the same boat. You know, I would have seen over the years, certainly in the local government sector, collaboration with one county being flooded, you know, having flooding issues, and other counties coming in with their resources and their equipment. But this was everybody together. You know, I think we as a country, we are very likely to help and to support and come together to overcome whatever comes to us. And I think we saw great examples of everyone really putting their shoulder to the wheel, you know, a lot of late nights, a lot of weekends, a lot of everything. But everything had to be done, and it had to be done fast. I just hope that when we come out of this, that we don't go back to having to double, triple and multiple check everything before we can do anything again, and that we carry the momentum forward on this to be able to move much faster to bring innovative solutions into implementation.
Yeah, and I suppose that kind of touched on Marco's point where he said, right now we're all learning by doing. The environment around us is changing and we need to react. So, Martin, from your own perspective, like how did you find maybe the decision loops were talked about yesterday? Anthony Staines talked about the decision loops been so long in the HSE at times, that from the front line to the department back to central government, that ideas can die along the way. And how do we kind of close them decision loops to make decisions happen instantly?
Yeah, I like what Noeleen said about everybody pulling together and so on. But what we had to do was use guerrilla tactics. So, for example, the remote COVID-19 solution, we actually had that developed, deployed, and being prescribed by hospital before kind of the mainstream HSE organization knew about it. And if they knew about it, there would have been so many opportunities to actually say no to it. I'm pretty confident it would never have seen the light of day. So we had constructed an alternative digital innovation pipeline with light touch but appropriate governance, and we were able to use that process to dramatically accelerate the adoption. So, like Noeleen, my hope is that post COVID we don't have to go back to a situation where everything is double and triple checked, and hopefully we can see a sort of a more agile public service response on what Marco talked about, rather than waiting for a crisis to drive innovation. Innovation becomes a way of life or the new normal.
Awesome. And then, Martin, I suppose I've heard you nearly, anyone that knows you or that has been around you knows that you've almost coined the phrase now, stay left, shift left. And this has become somewhat of a mantra for the transformation unit. Would you be able to expand on this idea a little bit more?
Yeah, so stay left, shift left, and thankfully we've been using it to orchestrate the entire ecosystem, and thankfully the system has sort of used this as a way of directing itself. Every time we look at a digital innovation, we're looking for 4 different characteristics. The first one is we're looking for an improvement in cost of care. Then we're looking for a reduction in cost of care. We're looking for an improvement in quality of life, and we're also looking for an improvement of clinician experience. When we look at an innovation, we're able to score it against those criteria, but we also look at the doability and scalability of those solutions. So we really have a managed portfolio. Now, digital technologies are exponential, and we're routinely seeing the opportunity to see a 10x improvement in care or a 10x reduction in cost of care. But that also needs to be coupled with an exponential mindset. If you have exponential technology and just an incremental mindset, all you'll get is incremental results. So it's very much about, we're working very much around culture change as well. So when these exponential technologies come along, that it is coupled with an exponential mindset, and then you get exponential results. And what we're trying to do is showcase and demonstrate solutions where exponential results were delivered, and that stimulates and motivates other people to think, well, it can be done in other areas. So we're hoping that Stay Left, Shift Left will become a self-fulfilling promise, and more when we're approached by companies, they're telling us, here's how a particular solution can help us stay left, shift left.
Yeah, and I suppose like any good campaign, it's great to have a nice catchy tagline, and Stay Left, Shift Left is one of those, and I'm sure it'll be mentioned again. Marco, we already spoke about this listen, analyse and generating shared understandings that is OPSI. You mentioned a bit about the government aftershock event. I've kind of had a little bit of experience in that myself, trying to help out your team. You might just give us a little bit more information on that, where people could find information or getting involved or participate.
Yeah, sure. And I think that the tagline we use for this event speaks for itself. We call it an unconventional event for unconventional times. And I think in a nutshell, it's really about not really preaching or telling the way to go, but mostly sort of a global exercise of collective intelligence and also sense making, trying to see what are the things that have emerged during the crisis, what are the implications for government going forward, and what is going to be the government of the future looking like. And it's going to be very different. What are the features, what we need to keep, what we need to leave behind. In a nutshell, is about this, but it's also around 50 events self-organized on day one, and there is still space if any constituencies want to propose an event, a workshop, or a local conversation that we know it's happening from now till the event date. On the 18th, on the Global Forum, we have about 30 sessions that are very varied, from the discussion on the future of the public health, the future of employment, the mapping of the SDGs actions post-COVID, global sense-making tool, and the anticipatory innovation government. So a lot of subject that we are attempting covering into this. 20 ministers confirmed, 4 heads of state and government will participate into this. So it is going to be a big event where we hope that we can distill some useful lessons going forward. In order to participate, there is a registration needed. It's open to everyone, no civil servants, but beyond that, they can go into the site and OPSI, the OPSI website, and subscribe and register to participate. And we hope that many of you will be able to join us for this global conversation.
Thanks so much for that, Marco. Hopefully maybe someone in the team might be able to put a link into the chat function below that viewers still here could log into. Finally, Martin, I'll just ask you one quick question from the audience. Lorraine asks, does Martin think temperature scanning kiosks rolled out across nursing homes and hospitals nationally would be able to help the fight against COVID?
I think very much so, and I think some nursing homes have taken the action themselves to introduce these thermometers. You routinely see them at restaurants and golf clubs. So I think if we were able to do that, it'd be just one other tool that could help us in this fight against COVID-19.
Excellent, thanks so much. Yeah, I can see Catherine there. Marco has added in the link to Government Aftershock, so hopefully a few people will register today. Again, I could talk to you all day. Unfortunately, we're limited by the hour. Next year, hopefully, if you all can come back, I'll schedule it for an hour and a half. Personally, I'd love to just thank the 3 speakers today, Noeleen, Martin and Marco. You've been incredibly generous, not just today, but in the last few weeks, the lead up to this, with your time. And it's been my absolute pleasure to moderate this session today. And I want to thank you for being part of Innovation Week 2020. I also want to thank the team here as well. In the background, Breda running the show, Catherine on the comms, Dean and Anne troubleshooting everyone's online issues, and of course our technical partners Lumio for making the show go on. I hope you can log in at 12 o'clock to view Lars's keynote on making innovation stick. He's going to give out some practical tools for innovation. And finally, I'd just like to thank you for your attention and hope you enjoy the rest of your week. Take care.